Hi, I'm David Munday, the Public Health Consultant at Reading Council. And last week I gave a short update on the situation in Reading and invited your questions to come into us. So today we're going to cover a few of the most popular questions, starting with a bit more detail about cases in Reading and that rise in cases I referred to last week. So to understand what's happening locally, we look at several metrics because no one measure gives us the full picture. So currently in Reading, we're seeing a weekly rate of 85 people newly positive with COVID for every 100,000 of the population. And to calculate that weekly rate, we look at the number of people that have tested positive in the last 7 days, but we calculate that every day for the last 7 days. So it's a rolling 7-day calculation we do each day to see what's happening with numbers. And when I look back at what that number was 4 weeks ago, it was in single figures. It was 6, 7 or 8 per 100,000 of people in a week testing positive, and now it's at 85 for 100,000. So clearly it's increasing. To put that into some context, in the Slough area, we are seeing about 140 new cases for every 100,000 of people. And in other parts of the country, we're seeing in Manchester about 400 per 100,000 and Liverpool up to 600 per 100,000. So although our numbers are maybe lower than in those comparator areas, we are certainly seeing a sharp increase and can see the trajectory that we're on. One of the other areas that we look at is of everyone who is going for a test, the proportion who actually test positive. So for every 100 people in Reading that were going for a test back in the end of September, around one of those 100 people was coming back with a positive test result showing they did have COVID. We're now at between 4 and 5 for every 100 people that go for a test come back with a result showing they have COVID, which is a strong indication that the prevalence of the virus, as we would describe it, is increasing, i.e. it's far more commonplace among our communities. Now, there are lots of reasons for the fact that there's rises in cases. One important reason is we think due to the household mixing that is occurring, we know that the virus is more likely to be transmitted indoors. And that mixing with people who aren't in your household spreads the virus between groups of people. So we are seeing cases in a range of settings, so in some businesses, in some schools, in the university, in care homes. However, these are small numbers of cases. We're identifying them quickly. We're doing the tracing of those cases, and we haven't seen large outbreaks in any one setting. So there's no single sector or institution that's driving the rise in cases. It's really a more community spread that is occurring. If you want to look more at the data that's available, you can go to our COVID specific website for Berkshire, so that's berkshirepublichealth.co.uk. And that website has got the latest numbers on for each of the council areas in Berkshire, and we're adding more data to that all the time. So for those who want to look further, I would recommend that as a useful source of information. So after last week's video, we also had questions about what the council is doing to tackle rising rates of the virus. And there are a number of varied things that we are engaged in. So firstly, we know testing's vital for the fight against COVID, and we're securing new test sites for Reading to make it easier for people to get tests locally, ensure that it's easier to ramp up testing if we need to. So the nearest permanent sites that are there every day, available every day, are in Newbury and in Slough. And we have a mobile testing unit coming to the Prospect Park car park on 1 or 2 occasions every week. But we now have a new site set up on the University of Reading campus, which will be live from the beginning of next week, available for the community to use as well as for students locally. And we're then continuing to seek approval for further permanent sites in Reading so that accessing testing is as easy as possible. But remember, you do need an appointment to access any of these sites. So you book a test through that national system. That's either by calling 119 or on the NHS website. It's nhs.uk/coronavirus, and you can book a test if you have symptoms and need to get tested. So away from testing, we're also setting up an in-house contact tracing team at the council to work as part of the national test and trace system. And that's to ensure that we get in contact with more people who need to self-isolate. And we know that it's really important that to reduce the risk of the virus spreading further in Reading, the people that are with a positive result and their close contacts both need to isolate to avoid inadvertently spreading the virus further. So that system will be live later this week, and we will be providing more details very soon about exactly how that works. Further, we've created a dedicated team to support businesses and venues in Reading. So that team makes visits to check sites of COVID secure measures in place. They provide information on the government guidelines, and if necessary, they enforce rules through fines or other means, such as even forced closure. So we don't want to have to do that. So the focus is on helping businesses and venues stay open in COVID secure ways. Now, you may have heard already in the local media that we are starting discussions about whether Reading should move into tier 2, so the high risk tier, and the restrictions that apply within that national tier system. Moving up a tier could well help us slow the spread of the virus, really by reducing the mixing between households, especially indoors. And as I said earlier, that's something that we think is leading to the increase of rates that we're seeing here. But we only want to do that if it's necessary. And right now, at this moment, we do remain in tier 1. So finally, in terms of our council actions, we're also providing people with information through videos like these, which I hope you're finding useful, through our website and through emails and newsletters. We're using social media, we're using the local press. We have put up signs around the town and introduced measures such as one-way systems to make it easier to socially distance. We're working closely with partners and asking for feedback so that we can adapt materials to reflect what's really needed. So, for example, there is a page on our website that shows where to get materials in sign language, easy read, and in translated formats. And then finally, we had a number of questions come in this week about when to get tested for COVID. So the key symptoms of COVID are the temperature, a new continuous cough, and that loss of or change of taste and smell. So if you have one of these symptoms, but you're not sure if it's cold or if it's flu or maybe if it is COVID, the advice, what I urge you to, is not delay, but get a COVID test. If what's going on is you've got the common cold or you've got the flu and it isn't COVID, the result of the test isn't going to kind of be in error and show you that you have COVID by mistake. It will only be positive if you truly have COVID. And then it's really important that you isolate yourself so that we can reduce the spread around our town. So thank you to everyone who sent in a question, and sorry we can't cover all of them here. We'll make sure that we do get back to those of you that have written in, and if you have further questions that you'd like us to answer, then please do contact us. The email address is communications@reading.gov.uk. So thank you very much.